I think qualitative research is valuable because it helps us to think about illness experiences. So especially in terms of health, I think it's great for being able to talk to people about what it's like to endure certain challenges. And so biomedicine's great for helping people, around disease, but qualitative work just does such a great job of talking about illness experiences, so you can start to think about how certain treatments, biomedical or psychosocial, might work for people. So I think it can give you terrific insights, because you can have lots of good science, but if people won't take up the science, it's really hard to be able to sell certain treatments if people just aren't ready for them. The value, at least for me, around qualitative research is that you get to talk to a variety of people about one particular or two particular issues, and so you get to hear things that prevail across people's experiences, but you also get to hear about things that are maybe unique to that particular person. So it cues you to the things that you might be able to intervene around, and it also cues you to the understanding that not everything you do in terms of an intervention will appeal to everybody. So qualitative research works in lots of different ways. One of the approaches that we've used is photo voice, and so where we'll give a camera to participants and we'll ask them to take photographs about their experience of a particular illness or issue. So we've done it with men who smoke, we've done it with men who experience suicidal thoughts, we've done it with women and men who've lost a man to suicide. And the beauty of using that technique is that people take photographs and then they share the photographs with you, and you develop your questions around those photographs. So I think it's really helpful because it allows people to talk in the third person. It avoids that to and fro that often happens, where you're asking questions directly, and it gives you a little bit of distance. And I think sometimes, especially in the context of some of the depression and suicide work we've been doing, it really helps people. It can be quite therapeutic because it enables them to reflect on certain issues and events in a way that is not too confronting. So sometimes the method itself can be quite therapeutic, and so I think that's one of the things that qualitative work does really well. There's lots of ways to share the research findings from qualitative work, and there's traditional ways like publishing a paper, which is really, really helpful for guiding other people in the field and also telling the stories of participants. But with the photo voice, we've also mounted a photographic exhibition online, and so a bunch of photographs and the accompanying captions from participants are available for you to view, and I invite you to do so at www.manupagainstsuicide.ca, and it's a terrific way of orientating yourself to some of the products of the research, and it invites you in to think about the content, and I think it also evokes some emotion around how you might be thinking about male suicide, the sort of things that your perceptions and views about that. And I think it creates a terrific way of having a conversation that might otherwise be difficult to garner.